My name is Dr. Scott Desman. I'm an orthopedic surgeon specializing in joint replacement surgery, and today I'd like to speak about total knee replacement using patient-specific instrumentation and computer assistance. The goal of a total knee replacement is to replace the surfaces of the knee, and this is a model of a knee replacement with the implant on the surface of the knee. The job of the surgeon is to make sure that this is put in perfectly straight. Using computer assistance, we're allowed to preoperatively plan the surgery on a computer model of the patient's knee and then execute the plan at the time of surgery, giving a perfect result consistently and reproducibly every time in order to give the patient the best result possible. In order to execute a computer-assisted patient-specific plan, we first do either a CT scan or an MRI of the patient's knee. This allows us to create a three-dimensional model of that patient's knee on a computer. The three-dimensional model on a computer looks something like this. This would be the end of the thigh bone, and this would be an exact replica of the patient's knee. And this would be an exact replica of the lower tibia bone. They would go together like this, and this would be before any surgery was performed. This is all done on a computer, and what we do is we then place the implants precisely the way we want them to be at the time of the end of the surgery. And what the computer can then do is generate a 3D printer model of what we call a cutting block. And in surgery, we would get a plastic block similar to this, and that block would fit on the patient's bone in a very specific way. It just locks on. You can only put it on one way. It has little holes that we put pins in to secure it, and you can see through the top there's a line, there's a space, and the saw blade would be able to go through that and make a cut on the bone, and this would give us the exact cut that we planned preoperatively. That would be the cut for the femur. The tibia has a similar cutting device. This would show up in surgery, just this piece, and this piece would fit on the patient's bone again very precisely in a one-way method that locks in with pins through some holes in the cutting block. And you can see there's a slot here that allows the saw blade to go through that slot and cut the bone in a very precise way to make sure it's perfectly straight. By making these cuts very straight, it takes out all of the guesstimate that's done at the time of surgery when we do these manually, and the results are that the cuts are perfect. And in terms of the femur, we don't have to drill a hole in the bone to line up the bone, which we normally would do, and this reduces bleeding and reduces pain and improves the patient's recovery.